Hello, welcome back. It's me again, here to talk about something that's really important. This is a source of a lot of vision loss for a lot of people, and there's a lot of confusion about this subject. So I hope at the end of this discussion we're about to have here, you kind of get a basic gist of this very important problem, which is diabetic retinopathy. Diabetic retinopathy, I'll explain the whole process, but it's a really big cause of vision loss. Hopefully, you find what we're about to do here illuminating. Before we move on, just a reminder, who am I? I'm a retina specialist, an ophthalmologist who works primarily within the retina. My clinic is in Irvine, California. Here's the website. Anyway, what is the retina? Just a basic review of the eye anatomy. The retina is in the back of the eye. It's right here. Okay, you can't see the retina when you look at someone's eye. All you see when you look at someone's eye is like the front of the eye, the cornea, the white part of the eye right here. You can't even see the lens on the inside of the eye. Primarily, the problem of diabetic retinopathy resides right here in the very back of the eye. By the way, this is about 2 inches from the brain. It's a very deep structure. The retina's job is to feel the light. That's what the retina does. The light has to go in unobstructed, not bouncing off of anything, not blocked by anything in order for someone to see adequately. Now, understanding why diabetic retinopathy happens starts by understanding one specific aspect of the retina, and that is the blood flow in the back of the eye. The way blood comes into the eye to nourish the retina, to keep it alive, happens through arteries and veins. Arteries take blood into the retina, just like anywhere else in the body, and the veins inside of the eye, they take blood out. Now, if we take a photograph of the back of the eye, we can see a lot of veins. This is a picture of like an average retina. And if you look around, you can see all these red lines everywhere. These are veins and arteries. They're bringing blood into the eye. They're taking blood out of the eye. They're bringing in things like oxygen and nutrients, vitamins, sugar. And then the veins take away the CO2 and some other metabolic byproducts. If we take a picture of someone's eye when they have diabetes, this is what it looks like. In this case, there are a bunch of things here. There are these little tiny spots of bleeding. Okay, little tiny spots of bleeding. There are also a couple little white marks, like right here and right there. We call those cotton wool spots. And these little spots of bleeding, we call those intraretinal hemorrhages and dot blot hemorrhages. The reason why these things are happening is because in someone with diabetes, right where those tiny little red spots are, there's inadequate blood flow. Okay, inadequate blood flow. Now, at first, when someone has diabetic retinopathy and they have a retina that looks like this, the vision might actually be pretty good. It might be decent. This person might see 20/20. They're driving, they're working, they're reading just fine. However, over the course of time, particularly if the blood pressure, cholesterol, and the blood sugar remains elevated for years, then these tiny little spots where there's inadequate blood flow, they begin to get bigger and bigger and bigger. And we'll see that. And one way to see that is with a study called angiography. That's a study in which we put contrast inside of the vein of the arm. And when we do that, we see how the blood is flowing inside of the eye. This is an angiogram in someone who has contrast flowing through their veins, and we take a picture of it. This is average. This is how blood flow normally looks. And if we do this exact same study in someone who has really advanced diabetic retinopathy, this is how it looks. Notice the difference. If someone has diabetes and it's really advanced, there's no blood flow off to the side here. And also in the middle a little bit too. Whereas in someone without diabetes, without any diabetic retinopathy, the blood flow is rich. The blood is going everywhere. And if we kind of drill down into some of these territories, the body asks itself, okay, there's no blood flow here, there's no blood flow there, there's no blood flow there, and so on. It asks itself, can I live like this? The retina, in a sense, starts to cry out for help. Remember, at first, they're just tiny little spots where there's not enough blood flow, like, for example, right there. And we might see a tiny little hemorrhage on the examination. But if we do an angiogram and we reveal all these territories, we start to understand that this disease process might cause some trouble. These parts of the retina that are not getting enough blood flow, they cry out for help. And so what the retina does in other areas where there's adequate blood flow, like for example right here, the retina starts to say, we need to help our neighbors. And so what it does is it begins to grow new blood vessels. The idea being, if there's one part of the retina not getting enough blood and there's adequate blood flow right next door, let's get a tube of blood vessels and hook it to that part of the retina that's not getting it so that that part of the retina can live. But the problem is these blood vessels that grow, that are brand new, they're not really high quality at all. They are unlike the blood vessels that we're kind of familiar with. Like if you look at your hand, you can see all these blood vessels on your hand. You can kind of tap on them, wave your hand around, bump your hand on stuff. They really don't burst open that much. However, the new blood vessels that are growing to bring blood to these parts of the retina, they're looking for any excuse to bleed. And when we look inside of the eye, we can identify these things. Here's an example. See, these are the blood vessels that are inside of the retina when we're born. They come with us, and these are the things that are bringing nutrients and oxygen, stuff like that, to the retina. However, if we look next door, there's this blood vessel right here. See how abnormal that looks? It almost looks like a leaf of broccoli. There's like these weird little webs, these nets. You see that? These guys, these are fragile. If this person sneezes, rubs on their eye, laughs at a joke, bends down and ties their shoes, this thing is going to burst open. And these things can happen everywhere. For example, they can happen on the optic nerve. Here's the optic nerve right here. And there's a little family of blood vessels growing on the surface because of diabetes. And when we do the angiogram, we can see these things glowing. See how I'm saying this is not normal. These are blood vessels that shouldn't be leaking the contrast that's inside of the veins, but instead they do. And what happens when these things bleed? It looks like this. This person is blind. Now, I fix this problem all the time. As long as they meet me or someone like me, then we can fix this. We can cure the person's blindness. And there are actually 3 categories of things that we do. Let's discuss them. These 3 categories are injection, laser, and surgery. That's right. We inject the eye with drugs. You might say that's a horrible thing. It's actually not that bad. And by the time I do it, most people ask me like, when are you going to do the shot in the eye? And I say it's already done and I'm walking out the door in a kind way. The thing about the thing about each one of these treatments is they all have their individual role depending on where we are in the treatment process. We do an injection when there's bleeding right then and there because we want something to work immediately. Now, the disadvantage, though, of injecting inside of the eye is that it wears off. And the entire purpose of injecting the eye is to stop the bleeding. That's the entire purpose. If we don't inject the eye, then this crappy blood vessel on the surface of the retina, it continues to bleed inside of the eye. You look at the eye on the outside, and it looks totally normal. But on the inside, it's filling up with blood, and people see thousands of floaters and shadows and everything like this person. They're not seeing too well. They're just seeing this thing sitting in front of their vision, and they can't look past it. So like I said, this thing wears off. We inject inside of the eye, the bleeding stops, and then we wait for the body to kind of clean up the blood. Now, if it cleans it up really well, then what we can do is start to think about prevention. How do we prevent more bleeding in the future? If the medication that we inject inside of the eye wears off, something has to be there to prevent future bleeding. And that's where laser comes in. It's a preventative treatment. If we laser certain parts of the retina, then we can prevent bleeding. And it actually works for a lot of people. It has a curative effect. The only disadvantage of laser is that it works slowly. We can only do certain patches of the retina. We can't do the entire thing. It's kind of a pain to do it. But like I said, once we get enough in, once we have done several sessions, let's say 3, 4, in some cases 5 or 6 sessions of laser, it can prevent bleeding for a lot of people. It's not perfect, but for a lot of people it tends to work out. Now surgery has a role as well. The role of surgery is basically very straightforward to understand. It's if the eye is full of blood and we've injected the eye and we've stopped the bleeding and we've waited for the body to clean up the blood and it's not doing it. It can take a month, 2 months, 3 months sometimes for the blood to clear out of the eye for the vision to come back. Now, the chance that someone gets their vision back just by injections alone, that is injecting the eye, stopping the bleeding, and waiting for the body to clean up the mess, tends to be really high for most people. However, it's related to how much blood is inside of the eye when the bleeding first happens. If someone has a lot of blood inside of the eye, then really injections and waiting for the body tends not to work. We inevitably have to go to surgery for some people, but we still want to give it a try because surgery is always a last resort. Now, here's some examples of what happens when someone has this bleeding. Remember the last patient that I showed you? Well, this is what it looks like 1 month after we do the injections. So you can see that the blood is kind of settling to the bottom. Notice that the blood isn't fully gone yet because the body hasn't had a chance to clear out the blood. This is only a month after an injection, but nevertheless, it's actually done a really good job. And if you kind of zoom into the details, you can see there are a couple new blood vessels forming on the surface of the retina before an injection. And if we fast forward a month, they're starting to shrivel up a little bit. Here's a more dramatic example. This person has this blood vessel right here, this crazy, weird-looking net-like formation of blood vessels here. And 1 month after injection, they're all gone. Almost all of them. You really have a hard time finding them. This is great. Now, these are the things that I do when someone has diabetic retinopathy. Like I said, we inject the eye to stop the bleeding, to let the body clear out the blood. And if it does a good job, we start to laser the retina to prevent bleeding. But if it doesn't go away, we do surgery. And those are the things that I do. But when I meet someone for the first time, I'm always telling them, these are the things that I do, but you need to work too. Diabetes, after all, is a relentless condition. It's chronic, it lasts forever. There's no real cure for a lot of people. Even when you control the disease with your diet and exercise, you're still at risk all the time. So you have to always stay on top of it. And there's specific ways in which you can do that. Certain things that I've already mentioned, like control the blood pressure, control the cholesterol, and also the blood sugar. Now, when we check our blood sugar using like a scanner on the shoulder, or if you prick your finger, you know what the blood sugar is at that moment, but you don't know what it is kind of on average. Now, there are some apps that come with a scanning thing that attaches to the arm that can kind of give you a general sense of what the average blood sugar is. But one thing that we really care about in the eye is the A1C. This is a lab test that's done to assess the average blood sugar over the last 3 months. The higher the A1C is, the greater the chance of there being blindness, and also the greater the chance of having kidney disease, heart attacks, even premature death. If the A1C is above 10%, almost 80% of people die in 10 years. It's a very predictive number. It almost is our destiny in a sense. So if someone can bring the A1C down to like 6.5%, then the chance of there being any blindness, any kidney failure, any heart attacks is much less. It's not eliminated, but it's much less. And by the way, you heard me say 6%, 11%, 10%. This number is expressed in a percent. It doesn't sound dramatic. It sounds like you should be saying, oh, the A1C is 1 billion, and that's why the risk of blindness and death is so high. We express it in a percent. So what we want with an A1C is somewhere in the 6% range. But if we can't get there, that's fine. At least we got to keep it below like 9 or 10 or 8, because if we can't, then the chance of there being blindness and loss of vision is much higher. Now, by the way, there are other reasons for which people can lose vision from diabetic retinopathy. Bleeding is not just one of them. It's a major reason why people go blind. And this is the #1 cause of blindness in the working population in the United States. So there will be other videos about other ways in which people lose vision from diabetes, but this tends to occupy the mind of a lot of people. It tends to be a source of trouble. So I want to thank you for coming here and listening to one of my videos. Again, like I said, my name is Zach Oakey. I have a clinic in Irvine, California. If you're ever in the neighborhood, feel free to stop by. Thanks.